Stress can feel loud, but Colorado spring knows how to turn the volume down. As the snow melts off the peaks and the first wildflowers push through the soil, your body is getting a quiet invitation. Step outside and reset. Research shows that just 20 minutes in nature can lower cortisol, slow your heart rate, and ease anxious thoughts. No workout gear or apps required. In Colorado, that could mean a slow stroll along the river, breathing in that cool, pine-scented air, or pausing on a trail to really notice the sound of birds and water instead of your notifications. Let your senses do the healing. Feel the sun on your face. Watch the light shift on the mountains. Listen to the wind in the aspens. Each small moment tells your nervous system, you're safe, you can relax. This spring, think of nature as your local stress therapist. Free, always open, and just a short walk or drive away. Refresh your mind, one Colorado step at a time. Step outside and breathe Colorado in.
Hey everybody, we're back. I'm Adam, and we're joined today by Dara, our nurse, and also my wife. So in our little series here at the podcast, we've been focusing on community. We've been focusing on how to do medical and wellness care better. So for today, we're going to really focus a bit on fatigue and suboptimal medical care, really. So actually, I'm going to jump in and then I'll back up. So Dara's been a nurse for 23 years or something like that. Used to work in hospitals, needed home care. And then I dragged her over to New Med in around 2000. So you initially did not want to come over because you didn't want to give up the high-paced nursing life. What brought you over?
Actually, I think I just got sick of running around doing all that nursing stuff. And also I wanted to support our family business.
So, and I know there's another answer behind there also. So when you did, I was always impressed with this. I'm not a nurse, but home care. How long were your notes?
Oh, yes. Medicare notes. Very long, time consuming for sure.
So in medicine, we'd have like a 1-page note. What did you have?
Oh, gosh. I don't know, 20-page notes.
That's insane.
Plus, yeah.
And how much of that do you feel actually helped people get healthier?
Yeah, it's all insurance. That's all it was for.
So it was to make them healthier?
No.
Just to check boxes?
Yes.
You know, were they smoking or could they do this or do that?
Just to pay for the home care. Yeah,
yep.
That's all it was.
So we yanked her over to New Med in around 2000. And she went and got certified in functional medicine. And I call her the supplement queen because she digs and dives into all the different things because we have a lot of our patients asking us questions. So to pull that in a little bit, now today we're talking more about, I guess, fatigue as a subject, but not the only thing. It's part of it. So we have new patients coming to us all the time. Some of them come in because they heard they wanted to join a practice and do something different, but there's a recurrent theme for a lot of people, even our friends. When we're talking to our friends, when people say, "Oh, my healthcare is amazing and I feel great," or if they say something else. So what do you find? Because you take phone calls sometimes, I do.
As far as...
Why are they looking for us?
People are sick of the insurance runaround. You know, they call, they just... it's whether the billing is unstructured, they don't know what they're getting billed for, and they get landed with this big payment that they weren't prepared for, or they book out months in advance, they can't see their provider. And when they do see their provider, it's in and out. It's checking the boxes. Literally, they don't really listen. They don't get to the root of what they're there for.
And how do they feel? Healthy?
No, they're all tired, fatigued, and they all are just, there's something missing. And they don't know what it is, but they just don't feel right.
And I noticed this just myself with a couple of new patients this past week. They'd come in and they'd say, well, I have a question. Previously to their medical people, they'd say, I have a question about something. It's okay, referral. And I had a question about this test. Yep, referral. And then they're waiting months and they're going to see people. They're telling them different things. You recently reviewed a med list for me with someone and a supplement list. And how many meds were on that list?
So
she yelled at me.
Yeah, this is it's disturbing because she's so mismanaged. She has so many other providers, and people just keep tacking on more medications for her blood pressure and diabetes. And before you know it, you've got multiple different meds for the same diagnosis, and she's not.
How does she feel?
She's not doing well at all, and it's polypharmacy where she's just over medicated, and she doesn't feel well. She's dizzy. She's got fatigue for sure.
So, and with that, so then I'm going to switch gears a teeny bit. So they come in feeling like crap, right? So with that, they come in and they say, my other person said my labs are all normal.
Yeah.
And the thing I talk a lot about is there's average. Diabetes is pretty average. It's more than not blood pressure and cholesterol. So there's average. Then there's actually normal. And then there's this weird, elusive thing called optimization. and I'm going for it. You're going for it.
Yeah.
It's weird because I've had this thought myself, and I've had 2 people in the last probably 24 hours say, literally, they said, I don't know if I feel my best. Like, how do you know if you feel 100%? This might be 100% for me, or it might be 50%. And another phrase I could say is, this is the best I have felt. I don't know if it's my best. So I have to keep digging and doing things. So these people that are feeling so dragged down, what kind of things cause that?
I still stick with the number one is emotional health. I think that is the underlying for a lot of this. Then there's sleep. Nobody seems to be getting, good quality sleep. Sense of purpose. Their nutrition could be lacking.
She's listing off our pillars. And then there's, what about movement?
And then, they're sitting at their office desk all day, and they're just exhausted when they go home. So they're not really moving around either.
Yeah. And I'll say this, all of them have an up and a down. I could be exercising too much. And some people are just so driven because they feel bad. They're doing craziness. Their cortisol's all whacked out. So, all these different things. And with food and all that stuff, there can be inflammation as a compounding factor. So all these different things. So, when someone looks at that lab report and they say, yeah, you're fine. Like so many people, literally, they get teary. They're like, I'm not fine. Damn it, no one's listening. You're not hearing me. So, and that's why we really try to dig a little deeper. And we had a woman about 1.5 years ago who had some, well, I'll just say she had some pretty advanced cancer. And I was chatting with her, and I'm pretty casual, meaning I'm approachable, but we were talking. And I said, yeah, but how are you doing? And she said, what do you mean? I said, well, you're still a woman. Like, how are you feeling? And she almost got a little teary. She goes, everyone just looks at me like I'm a cancer. And I said, yeah, it's ridiculous. You're not a cancer. You're a human. So all of that stuff, we got to push harder. We got to do some deeper digging. There's a person, and I was just moving something up to see if I need to address anything. But as a person, I heard this. I should have double-checked this right before this, but I think it was Mark Hyman or someone said 37 billion things going on in the body at all seconds. That's 24 zeros. You get a lot of stuff. People are complex. So to just say labs look good, it doesn't mean you feel good. They're a piece of the puzzle. So with that, we meet with people. We try to have a pretty detailed conversation, go through things. They'll meet with Dara, you, or me. But the question is, they leave and then everything's perfect, right?
No.
No, why not?
There's still a lot of work that needs to be done.
So we give them a plan, and they just go home and do it.
Not necessarily. They need some hand-holding. They need to be accountable and stuff like that, and that's what we're here for. We're here to help them every step of the way, as much as we can. Give them the tools.
Well, and I think if you tell me you're my wife, so you can tell me what to do. But for most people, if they tell you what to do, you could say, go to heck, like I'm not doing it. So I think if you empower someone and explain why they should do it or why they shouldn't do it, whatever,
Absolutely.
That's fine. The problem is, and it's not that we're judging like that, well, they should do it. We say we came up with an awesome plan. No, they need to buy in. And I remember when I first started thinking this way, the classic story is, grandma has diabetes and you're like, you don't want diabetes. Diabetes is bad. You should get rid of it and do what I tell you to do. And then she says, well, go to heck. I'm busy. I got things to do. But if you ask her, what do you want to do? And she says, well, I dream that in 5 years from now, my granddaughter will be old enough. She'll be playing soccer. I want to go to the field and watch her play soccer. Oh, that's what she wants to do. That's something actionable. Because if you go blind and have to be on dialysis, you might not be at that field. So that's a reason why. And like for Dara and I, we keep each other accountable. We're doing things together. So some of our patients, sometimes they go home and the other partner or whoever is not doing what they're doing. So that's a reality.
true.
That's a really challenging thing. Also, people have kids, dogs, houses, second jobs, all these other bits. So they leave with the awesome plan, but it's not like a one plan and you're good for the next 45 years. It takes a lot of touches and a lot of rechecks. So, well, I guess I'm talking here for this part. But another thing that I would say is, for a lot of people, it's all or nothing. So today I will run a marathon. It's like, no, you won't. You haven't moved in the past 4 years, right? So I think you've heard me saying this is baby steps.
Yeah.
And we've had people wake up with a heart attack, which is horrible, but they didn't die. So take a baby step forward or back. So trying to think of where we should go from here. So there's baby steps, moving forward.
Labs or
Yeah. What are you thinking? Yeah, this is a free-for-all, Dara. This is just what we do.
I mean, I think our patients are just amazed by what Adam, goes through the labs. Nobody's ever talked to them like this because they're looking at like the LabCorp values, the ranges. So just looking at that optimal and giving them the reasons why for the optimal ranges, like those, just for some reason homocysteine is popping in my head, like it's a blood vessel inflammation marker, which is kind of important. You think of like dementia and stuff like that.
The nice thing is, if it's often abnormal, what do we do to fix it?
Yeah, it's pretty easy. You just take some methylated B vitamins.
So easy, so inexpensive,
Yeah.
and may sway the course of things 20 years down the road. It's
Yeah.
ridiculous. Some of this is so easy.
Another one that's popping in my head is insulin. When you go to your doctor, typically they don't check an insulin. They may do like the fasting glucose or an A1C, but insulin and insulin resistance causes so many like health concerns later on. I'm thinking of dementia. And the range goes up so high, the LabCorp range.
Yep.
And you really want it under 5, ideally. But on their
The range goes up to what?
I think it goes up to like 25.
Yep.
Something like
24.9.
that. 24.9,
Yep.
yeah.
It's insane.
And it's just not, it's not where you want to be. But they think, they leave their doctor's office and say that they're normal and they're all good, but basically they're just not in danger of dying anytime soon.
Yes.
But we're looking for them to feel good and be their optimal selves.
Yeah, and I've chatted about this previously, but I got to say it. So feeling good now, and also the 20 to 30 year plan. So if someone's 30 years old and they come in, their 5-year risk of anything is close to 0. So you're fine, go away. If blood pressure's high, cholesterol's high, that's fine. It's good enough. That's good enough medicine. But if I'm that 30-year-old, I don't want to wait until I'm 40 and now I have problems. I'd rather not have the problems.
Absolutely. Yep.
So proactive care. Yeah, and this is a while ago, probably a year or two ago, Dara said, I'm listening to this podcast, and they said it's so much better than you. They said, he said, all chronic disease is due to metabolic dysfunction. And I was like, I say that. He said, no, not the way they said it. So I've adopted it. I have no idea who said that. But it is true.
Yeah.
And what Dara said before is emotional health. And you said that first probably 2 months ago. We were walking with our daughter, Emily, and you blurted that out. And I was pretty impressed. I was like, yeah, ulcers, back pain, headaches, insulin problems. It really is a lot emotional health.
Disease in the body.
Yep. That's why I think it was last month, we had Dana on talking about emotional, spiritual health. But our job as the medical folks and the nursing folks is to try to get people to optimize. And one thing I've been saying with those billions things going on, you don't fix that in a week. And probably not a year. How long have we been working hardcore on this? Probably 8 years, I think we've been doing it. And still learning new things. Yep.
Yeah, every day.
How do you approach this with your family? What efforts do you put in?
Okay. So we're not perfect. I want to start by saying.
She's not perfect. You heard her say that.
So, we still like to live fairly normally, and we're not, hyper about, the nutrition and all that. We try to get our, enough protein, fruits and vegetables, stuff like that. We try not to eat a lot of processed food. We don't go out to eat, that sort of thing. But we're not like we're not stressing about it. But, you've heard of the 80-20 rule,
What is that?
So 80% of the time you're following like a pretty, I don't want to say strict, but like a good diet to include those things. Healthy oils, all that stuff. And then the other 20% is like, oh, I'm going to have like a brownie sundae, or, I'm going to go out to eat and have a burger and fries. But for most of the time, you kind of stick to like pretty healthy eating. I think we're very good about being active every day. I have to say, I do love my Oura Ring, telling me my activity score and my sleep score and all of that stuff. And our whole family has an Oura Ring, so it's kind of fun in the family to keep ourselves accountable with the sleep and activity and all of that stuff. So activity, we walk our dogs 2 miles a day.
2.25.
And we try to strength train as much as we can, try to fit that in where we can. We have, some stuff in the house, so that makes that a little bit more convenient.
Like dumbbells in the basement, pull-up bar.
Yeah. And then what else?
Well, one thing that pops in my head is our friend Shane, who does some financial planning and all that stuff. We spend a lot of money on. A lot of our disposable money is spent on
food.
Yeah, we spend a lot of money on food.
Yeah.
And other people are spending it on vacations and things like that, which is fine. Everyone does their own thing. But for us, we decided years ago that it's really important.
Yeah.
What you put in your mouth is important.
Like if we're going to be buying, meats, especially like chicken and eggs, that, you want it from like happy animals, and beef, and you want them eating how the food they're meant to be eating, and grazing out on the fields. And so, yeah, especially chicken. You want that organic. If you've seen any of those programs, it's pretty dirty and gross. So, and same with vegetables. Like, you want to make sure, if you can't afford organic, just make sure you're really washing them really well and stuff like that. Yeah, I think that's important.
And I've said this many times on these little podcasts and stuff, is I talk about pillars, many medical people do, but nutrition, I think, is the hardest to figure out. Then we have movement, sleep and rest, stress management, and then sense of purpose. And, do we go out and hang out with our friends all the time?
No.
Who are we hanging out with a lot?
Ourselves.
And
the dogs.
Yeah, the dogs are a part of our family.
Yeah.
And I'm saying that because it's really significant, because we had a dog that had to be euthanized a couple of weeks ago, and like that was a family member of ours, and it was really hard. But I joke and say, well, it's like having 3 infants now downstairs. We have 3 huskies, but that's part of our sense of purpose. That's our people.
Yeah.
Or our
we're
relationships.
Dog people for sure.
Yeah, and our kids obviously, and close friends. So these are things we see missing in the folks that we meet with. And one way to tie it in is when we meet with people is, it's not just do you have high blood pressure? Do you have cholesterol? Okay, you're fine. It's, what kind of food do you eat? Are you moving? How is sleep? We do some deep dives with people on that one. That's a real challenge. Stress management. So many of our patients, I'm so stressed, I'm at the office and doing this. It's such terror, and a sense of purpose. We've got some people that are struggling with that, and that's so I say the hardest is what to eat. What not to eat's pretty easy, but what to eat, and then probably most important is the sense of purpose. And that's why we're far from perfect. We'll take criticisms, but when we do visits with people, we try to give them time. I try to slow down and be present.
Absolutely.
Yeah, and this takes, like I just said, it's taken us about 8 years. I used to eat differently. I used to also have more allergies. Kind of weird, So as you clean things, we notice the slow move toward optimization.
It's a slow shift.
Yeah. With that, I'm trying to think. I think we're coming up on time. Fatigue, just not feeling right, and could I feel better because I don't know what my max is. All those things. That's why and not a sales pitch here, but just whoever you work with in any field, are they talking to you? Do they see you? And are they willing to try to push the envelope to get you feeling better? Yeah. And the reason why this fits into this series is we wanted to raise the level of the community.
Absolutely.
taking care of each
Yep.
other. I mean, we're lucky. We live in a wonderful neighborhood. I told someone else this the other day, but my sister was visiting. We're walking the dogs. The neighbor came out, "Hey guys," and gave us all a hug, including my sister. And I was like, that sense of purpose. That's some wonderful stuff right there. We're very fortunate. So all of that stuff demand more. Life doesn't have to suck.
Yeah.
No, it could be so much better. And I always talk about ancestral living and tribal living. A tribe, people take care of their people, which is nice. So work on that and, lead by example. It's not me being preachy. It's me working at this. You too.
Oh, yeah. Yeah. Every
Yeah.
day.
And trying to do things just a little different, taking baby steps, sometimes a little bigger step. Sometimes we take a few steps backwards. That's fine. Everything's fine. We got that. And then we just keep going.
I do think we are passionate with the people we work with too. I want to say that, we really truly want to help.
We are far from perfect, like you said, Dara. But we want. It's kind of weird. We're getting a little sappy now, maybe, but we just want people to feel good.
Yeah.
Why? Well, selfishly, because then they're nicer.
Yeah, it's all for the community.
Yep. If the family next to us
greater
is a
good.
nicer family, then we can, support each other and do all that. And then they'll be nicer to the next person. It's a trickle-down effect.
Yeah, for sure.
So some of that, emotional, like Dara said. Some of it is sense of purpose, which is emotional but spiritual also, but also just your relationships with family. And then other parts are very physical, and that's why we go through all the labs and all that stuff. So I guess we'll wrap it up here. Do you have anything else you'd like to say?
I think that's about it.
Okay.
Yeah.
Well, thanks for joining us today, and go take a step forward.
Thank you.